Welcome to Mognable, where we serve you with authentic news, stories, documentaries, updates, and magazine-style insights of society and the larger world.
Ciwon fitsari ko yoyon fitsari da a turance aka fi sani da urinary tract infection UTI na ɗaya daga cikin ciwukan da ake fama da shi a duniya a halin yanzu. Sannan jinsin mata su suka fi fuskantar barazanan kamuwa da wannan cuta, wataƙila saboda alaƙar ɗaukan ciki da kuma haihuwa.
Cranberry juice. Many people reach for it to treat urinary tract infection or UTI symptoms such as painful urination and frequency.
And if it's getting better, then they're doing the right things. When it's not, when it's progressing to them noticing blood in their urine, if they're getting fever, if they're getting some low back pain.
Then, says Mayo Clinic family medicine specialist Dr. Summer Allen, it's time to see a healthcare provider to determine if you need antibiotics, which are the first line of treatment for UTIs. The type of antibiotic you take depends on the type of bacteria found in your urine. And Dr. Allen says the most common culprits are
the E. coli, bacteria.
Hukumar ƙididdigan yawan al'ummomi daban-daban a faɗin duniya, ƙarƙashin Majalisar Ɗinkin Duniya, ta fitar da rahoto bayan shafe dogon lokaci tana ƙididdiga. Ƙididdigan da aka fitar, kafin alƙalami ya tabbatar da cewa a duk shekara ana samun mata a faɗin duniya kimanin 50,000 da ke kamuwa da wannan cuta na yoyon fitsari. Sun alaƙanta hakan da cewa yana faruwa ne sanadiyan rashin renon ciki, dogon naƙuda a ta fuskan da bai inganta ba. Nahiyar Afirka a faɗin duniya na ɗaukan babban kaso daga cikin nahiyoyin da ke fuskantar wannan barazana a faɗin duniya. Idan muka dawo gida Najeriya, kafin alƙalima ya nuna a cikin kaso 100, kashi 40 na cutan yoyon fitsari na faruwa ne a Najeriya, musamman arewa maso gabas da kuma arewa maso yamma na faɗin ƙasar nan. Shin menene yoyon fitsari? Shin wasu alamu ake iya ganewa cewa mutum zai ji ko ya gani ya tabbatar da cewa yana fuskantar barazanar yoyon fitsari, musamman ga 'ya'ya mata? Sannan a likitance ciwon yoyon fitsari na da magani? Wannan na daga cikin tarin tambayoyin da muka shigo da shi asibitin koyarwa na Malam Aminu Kano domin jin ta bakin masana. Ku biyo mu domin jin cikakken tattaunawa da za mu gudanar.
Oh, remember how mom used to wake up before everybody to make breakfast, iron our uniform, and surprise that woman with something special.
Reward your mom with a trip to Zanzibar in the 2025 Three Crowns Mom of the Year competition. Write a note using each letter in your mom's name and submit with any of these on our website or at any of our collection centers. T's and C's apply. 3 Crowns Milk. Healthy moms, happy families.
Oh, remember how mom used to wake up before everybody to make breakfast, iron our uniform, and surprise that woman with something special.
Reward your mom with a trip to Zanzibar in the 2025 Three Crowns Mom of the Year competition. Write a note using each letter in your mom's name and submit with any of these on our website or at any of our collection centers. T's and C's apply. 3 Crowns Milk. Healthy moms, happy families.
Urinary tract infection. These infections affect any part of the urinary system, including the kidneys, bladder, and urethra. Symptoms include a strong and frequent urge to urinate, a burning sensation when you urinate, cloudy or strong-smelling urine, and a pain in the lower abdomen or back. While there are some home remedies that can help with symptoms, it's important to always see a doctor for proper diagnosis and treatment. It could be a more serious infection, and UTIs can become serious if left untreated, so don't wait. UTIs can be treated with antibiotics, and it's important to drink plenty of water to help flush out the bacteria causing the infection. You should also avoid caffeine and alcohol. You can try a warm compress to relieve any abdominal or back pain. Norton now offers 4 convenient ways to get care when you have UTI symptoms. Go to nortonnow.com to see your options.
A urinary tract infection is an infection of the urinary system. In women, it's usually the bladder. It occurs when bacteria get into the bladder. This bacteria can come from anywhere on the woman herself and usually occurs when bacteria that is on the vulva and the vagina and even the rectum are able to get through the urethra into the bladder and cause an infection. Recurrent urinary tract infections become more common as women get older. Most women start to experience recurrent urinary tract infections when they become sexually active, and recurrent urinary tract infections are frequently linked to sexual activity. The other main time that women experience more recurrent urinary tract infections is when they go through menopause. When women go through menopause, they don't make estrogen anymore. The lack of estrogen changes the microenvironment of the vagina. And if there are changes in the bacteria of the vagina, it will increase the risk of women getting urinary tract infections in menopause. There are many things that can be done to prevent recurrent urinary tract infections. Because women are infected with their own bacteria, it is very important to make sure that the bacteria around the rectum doesn't get anywhere near the urethra. Therefore, it is very important that women always wipe from front to back. Because women are frequently infected after sexual intercourse, it is also very important that women empty their bladders after sex if they are prone to urinary tract infections. The treatment options for recurrent urinary tract infection are, of course, first behavioral. Make sure you always wipe from front to back, and make sure that you empty your bladder after sex. If these are not working, there are some herbal supplements that can help. D-mannose is one, and cranberry is another. Finally, there is also the option of taking a low-dose antibiotic when you're sexually active. Urinary tract infections can go away on their own without treatment. Obviously, women were getting urinary tract infections before the dawn of antibiotics, and they would get through them, although they probably had a lot of pain. Frequently, women will worry that a urinary tract infection will lead to a kidney infection. Fortunately, unless you are pregnant or immunocompromised, this is quite rare. Here at Mount Sinai, your doctor will be sure to discuss all these treatment options with you to make an informed decision.
Anyone can get a UTI, but women are at highest risk. If you develop symptoms that won't go away, see your healthcare provider for evaluation and treatment to prevent a serious infection.